Hey guys. Just gonna wait for some more people. Hey, what's up, Brian? Can you hear me all right, Brian? Oh, my beautiful wife, beautiful pregnant wife has joined us. She called me out for not saying anything the past few times. Hi, babe. Hey, Shayla. Everybody's here. We'll give people a couple minutes here. All right. Yeah, I got the mic here, but I'm going to back away. Uh-oh, Carrie's in the house. Everybody watch out. All right. Give people another minute or so. You're welcome, Patty. Well, it's Friday, so it's probably happy hour most places. This is, you can definitely do this one with a drink in hand if you want. Water will do too. Let's see, hips are rusted in place. I'm gonna try my best. You could probably just hula hoop and loosen those up. But yeah, all right. Oh, your hips hurt. Oh, Mama Jenny. All right, so yeah, we're talking hips today. Hey, Mom. Your hips are important for anything athletic. Anything you want to do, you're going to need to produce some power, change directions. I'm glad your shoulders are feeling better. Yeah, so your hips are needed for anything athletic. Produce power, change directions, stop, start, so they can take quite a beating. But a lot of times with how we perform exercises in our daily routines, we do them pretty unidirectional. Running, we run forward. We very rarely change the surfaces that we're on unless we're hiking. So I really encourage people to go out and hike, get outside, change the loading patterns for your joints, those types of things. Also, with all the sitting that we do, we talked a lot about this stuff for your low backs on Monday. The same applies when we talk about the hips. If you joined that one or did that one on Monday, you saw that a lot of stuff that we did for our back was actually stretching and working on the mobility of the hips because they're so closely tied. If you have tight hips, it's going to influence the way that your pelvis moves, which is going to put stress on your low back. So those of you who might have some low back pain, this might help as well. Hip thrusts, you can do all the hip thrusts you want, Carrie. Yeah, this is, once again, it's just a simple follow along. We're going to start off hip flexors, then the back of the hips, and then we're going to use some new range of motion that we find. So hopefully all you guys enjoy this. And leave some comments. Let me know what questions I can answer. I'll try to scroll through at the end before you guys take off. So yeah, happy hour, Friday happy hour, healthy hips. I'm going to get you feeling good, feeling strong. So anything you do as far as your workouts and fitness and just lifestyle in general, you feel good. So I'm going to put the mic down, try to yell so you guys can hear me. All right. So just like the other day, we're going to start off with our hip flexors, and we're going to be using them. So we're going to be doing the little hip flexor isometric on the ground. So we're going to push our hand into our knee into our hand, and we're trying to actually tell our hip flexor to turn on and then to turn off. Because all that sitting and keeping our hip flexors short in the front of our hip, they're always kind of just shortened. Our muscles have an elastic quality where they'll just get shorter and shorter and shorter if you keep them shorter and shorter. So you go to then stand up, and all of a sudden your hip is really tight, and then your back gets stressed. And so we want to tell our muscles when to turn on and when to turn off. So we're going to go through that right now. So on our back, you can grab a pillow if you need it. All you're going to need today is a pillow and a mat. And so we're on our back, 90 degrees at our knee, 90 degrees at our hips. And I'm going to push up with my knee and down with my hand. It's like a 3-second hold. Nothing too crazy. And we're going to run through 5 of these. And we're going to do both sides. And then we're going to do a hip flexor stretch. If you stick with me long enough, if you go back and you look at Monday's stuff, I'm always going to make you do a hip flexor stretch for your hips. I'm I'm always going to make you do one for your back. All right, and now you're going to switch it up, other side, just 5. Maybe you've been doing some tone up workouts and your hips are probably a little tight because I know that Kat and Karina have been making you work your booty. We'll get to that stuff next after we address our hip flexors. 2 more. Good. And I forgot to mention, just like on Monday, you want to be really focusing on straightening your bottom leg. So you're actually using that glute, getting kind of everything in line in neutral position. So, you don't probably want your pillow. This is it, guys, for your knee. Doing a little hip flexor stretch. So we use those muscles. We turn them on, we turn them off, we turn them on, we turn them off. And maybe they're a little bit more relaxed and they're going to be more susceptible to being stretched. So you're just going to have one knee down on your mat, your other foot forward. You got 90 degrees at your knees and your hips. Your back toes are down. That's going to help you maintain your balance, but you can hold on to something, couch, chair, maybe a broom, something like that. You're going to start bent over and you're going to tuck your pelvis underneath. And from here, you're going to bring your chest up. And we're just going to be here for a minute. But you might just hold this stretch maybe for 5 seconds and then take a breather, give your glute a little bit of a breather, and then you're back into it. Now, the biggest mistake I see with this stretch is actually people start to get a little too aggressive with it and they start saying, I don't feel a stretch, I want to lean back. That's going to put a lot of pressure on your back. Instead of doing that, you just reach back and you get a little bit more pull through your quad, a little bit more through the anterior hip. Let's see here. So about 20 seconds left, I'll drop back down here. And so if we have tight hip flexors, it's going to make it really hard to get into extension. An extension of the hip is where we get a lot of power for our running, for our jumping, for your golf swings, for your kettlebell swings, for your deadlift in the top of your squats. So it is important, we'll go ahead and switch. It's important that we be able to access all that hip extension. So if you're missing, I'll take a break here, if you're missing the ability to get into that top position, extended position, maybe you get here, you're going to try to cheat it with your low back. And we don't want that, and that's part of the reason why we want nice, healthy hips. And so we can access all that range of motion and exhibit as much strength as we have. It also spares our back. So, got about 30 seconds left here, just on a nice hip flexor and quad stretch. Remember, you're not leaning back. If you need to hold on to something, please be my guest. And we got about 20 seconds left, somewhere around there. Just stretching out the front. You should feel it here. Shouldn't feel any pressure in your low back. If you do, and you're trying this one out, just lower that foot. Push your hip forward just a little bit if you feel that. All right, so we've done our hip flexor stretch. We'll probably revisit at the end. And I'm trying not to go for another 45 minutes, but who knows what will come out of my mouth these days. So we've stretched the front of the hips. We're now going to the adductors, these inner thigh muscles. They're often ignored, but if we are maybe a little bit weak in our glutes or we're compensating for a lack of strength, our body's going to start to recruit our inner thigh muscles to help out with hip extension and even hip flexion. And so they're another muscle that gets really short from sitting too. So this is called a frog stretch, and you're going to actually have your knees separated on your mat, and then you're going to put your forearms down, and you're going to try to just spread your knees a little bit more and more. And your foot position is down here. Your feet are flat, okay? So you're not trying to keep your toes down here. That's actually probably going to put a lot of rotation through your knee that you're not going to like very much. So I'll go right here. So wide, down on my forearms. And I'm trying to keep a nice neutral spine. I don't want to be too rounded. If I'm really rounded, you're probably going to want to narrow up your stance a little bit. And we're just hanging out here for 1 minute. And after a minute or so, or maybe a couple seconds, if you want to get a little bit more stretch, you can put one hand behind your back and you can open up. And so if I open up to my right, I'll feel a little bit more stretch in my left inner thigh. And I'm just going to do 5 of these guys. And then I'm going to do the other side. And you don't have to do this. If you're just feeling a good stretch here, then that's great. Just hold that for a minute. It's gonna help you get a little bit deeper into your squat, maybe get into a more athletic position with anything that you're trying to do. So that was a frog stretch. That was for the adductors, those muscles that assist with hip extension and hip flexion. So we have 6 of them, and 3 of them actually help flex and 3 help extend. And then they also help bring your legs together. So we're gonna just do a nice piriformis stretch or a pigeon pose to stretch out the back of the hip, the glute muscles, the piriformis muscles, or hip rotators. There's 8 of them. We just kind of group them into something, and we call them the piriformis because that's the biggest one. You're gonna start off hands and knees. You're gonna sneak one foot in front of you. It's gonna be kind of trying to get parallel. That's okay if it's not in front of you, okay? You'll see my foot's at an angle just because everybody's hips are a little bit different. We're all shaped a little bit different in our joints, and this is where my hip lets me go. From here, I'm keeping my chest up, but I'm sinking down into my right hip. I'll do it on this side first, but you guys can maintain that side. So I'm sinking down into this hip, feeling a stretch in the back of my buttock. Opposite leg is straight. And we're just gonna hold this for another minute. A lot of times we sit all day, and we don't really use our butt muscles. And there's this term that's kind of come to popularity, at least in the PT world, called glute amnesia. And it's the thought that your butt muscles kind of forget what to do when you go to use them. And this is where sometimes you get a lot of cramping in your hamstrings or your low back. It does a lot of the work. It feels really tired when you go to do some glute dominant exercises, when you go to do things like bridging, kettlebell swings, deadlifts. A lot of people feel in their hamstrings and their back because their glutes are like, hey, I've been stretched out all day. I don't really know what to do. So we're going to address that in a little bit here with some bridges, some single leg bridges, clamshells, hydrants, a bunch of stuff that's going to make your hips work really, really hard. And then you're going to switch sides. That was 1 minute. I think so. Maybe I was talking for 2. Who knows? There we go. Remember, chest up here. We don't want to be down in this flex position with too much rounding. You're going to be able to cheat this stretch if you do that. If you keep your chest up, you'll feel like you can probably get a deeper or more aggressive stretch into your hip. And if you're comfortable here, hold it. But if you're uncomfortable with this one, that modification is crossing over and threading the needle and pulling your knee up to your chest. And if that's even uncomfortable on your knee, you're just going to take that knee and pull it up across your body. And I'll stay here for the remainder of the time. Still feeling that stretch here. It's just a variation. It might be a little bit more comfortable on your knee, maybe even a little bit more comfortable on your hip. Or maybe you're just laying down on you like laying down on your back when you exercise. All right, so about 3 seconds left. Ooh, all right, so we've stretched out the fronts of our hips. We've stretched out the backs and the insides of our hips. And so we're going to kind of use that range of motion just like we did the other day with those 90-90 sits. We're going to progress it a little bit from the other day to use some activation where we're going to actually use our butt muscles at the end of all of this. So once again, you're starting with your feet about shoulder width apart. I like going no hands because it requires a little bit more control in my trunk. But if you need to, you can lean back. That will kind of get you a little bit more range of motion in your hips if you feel a little stuck. But you're here, and you're switching. You have about 90-degree bend at your knees, 90 degrees between your thighs, 90 degrees on the other side between your knee and your thigh. And you're just going side to side for 5. And then you'll probably start scooting a little bit. Kind of like my dog, scooting on the ground. Katie knows that one. All right. So we've got our 90-90. I'm going to scoot back for this one. Shout out to Frankie Tater Scott, our little French-English bulldog. She's been a great companion during this quarantine. So we're going to go down into this 90-90 position. You might want to scoot your feet back just a little bit. And from here, you're gonna go up. You're gonna squeeze your butt cheeks together. You shouldn't actually have too much rotation going on in your knees, so this should be pretty comfortable. And then you're gonna go down and up. So you're using your glutes, using your glute medius. If this is uncomfortable for whatever reason, you can just keep doing your 90-90 sets. And we're going 5 on each side. Stretching out the front of the hips too at the top. That's what hip extension is good for. One of the things it's good for. And you got one more. You can do this with a rubber band at your waist if you want to load it up a little bit more. You can hold a kettlebell or a dumbbell. Now we're going the other side. Here, going up. Feeling a lot of stretch here on my right hip. 2. We're using that range of motion we got from stretching out our hip flexors. But when I come down here, I'm using the range of motion we got from just doing that pigeon pose in the back. 2 more. And 5. Okay, so done a little bit of internal rotation on the hip. So internal rotation again is when the thigh rotates towards the midline of the body. If you go away this way, we got external rotation. So we did some internal and external there. We stretched our hips for external rotation with the pigeon pose. But a lot of times people ignore using their muscles to actually create hip internal rotation. Now, a loss of hip internal rotation is shown to be one of the indicators for someone who's going to suffer low back pain in the future. And so if you're lacking internal rotation of your hip, it might put a lot of undue stress on your back if you go to do some rotational movements, especially like golfing, tennis, throwing activities, things like that. So we're going to be laying on our backs with your legs up in 90-90 position. And you're going to put your fists together between your knees. From here, you're going to just rotate your leg out as far as you can, and then the other. You might see a difference. Now I'm holding my head up, but I actually want your head to be down on the ground. We're going to make 8 on each side. And you'll feel the muscles in the front of your hip working really hard. These are muscles called your TFL. It's a really long name, 3 words, just call them your TFL. I think we're halfway there. Don't forget to crush your hands together. All right, okay. And once again, if anything is bothering you while we do it, we're not doing any of these things for any long period of time. Just take a break, take a breather, find a position you like. Maybe it's child's pose, maybe it's corpse pose, maybe it's cobra, hip flexor stretch, anything that you know agrees with your body. So we're not trying to, treat anything specific here. We're just trying to run through things that make your hips feel good. And so that's the point. So if something's not feeling great, just take a break. So we're going to get into a little bit more of the active stuff, the stuff that makes you use your glute muscles, your glute medius, a little bit of your hamstrings, and even your trunk, because we want to incorporate the whole body when we start to retrain movement patterns. So this first one is a variation of a bridge. It's called a Cook hip lift or a single leg bridge. And if you're finding that your hamstrings are cramping, these guys in the back of your thigh, I want you to just move on to a 2-leg bridge. So you're just pushing your hips up towards the ceiling, but I want you to put your hands on your butt cheeks. It sounds like a crazy thing to do, but it's gonna make you have a better mind-body connection where you can actually feel your muscles tighten. And if you're with somebody in quarantine, maybe they can put their hands on your glutes too. Maybe that'll help you, I don't know. It's too bad my wife isn't here. But we're gonna do this single leg lift. We're gonna do 8 on each side. And I'll show you from the side here. So you're going to be laying down, and your ankles are going to be underneath your knees. And from here, you're going to hug your knee in towards your chest. If this bothers you, to put your hands on top of your knee, then grab behind. But I'm going to go here. We're trying to keep our thigh as close to our stomachs as possible. From here, we're going to be pushing with your down foot up. And now what's going to happen is if you are really, really tight, or you're not quite strong in your hip is you're going to open up here and your knee's going to want to come away from your body. But I want you to keep it as close as you can, and that's kind of the limit. So this is like the other day we had a self-limiting exercise. This is a self-limiting exercise, and that once your thigh comes off, you're done. You can't go any higher. And you should feel your butt working. Now if you don't, for the rest of you who do, you have 3 left. But for those of you who don't, hands on the glutes, pushing up high, feeling your glutes squeeze. So you're here for about 5 more. It's probably about time to switch. You might feel a difference side to side, and that's the great part is you can start to see asymmetries. What do I have to work on? What needs, cleaning up? Why does my movement hurt, or why is it uncomfortable, or why can't I do this well? And doing things on one side is going to allow you to maybe see a difference side to side. And then when you get as strong as you need to, or as mobile or flexible as you need to on that one side, maybe your movement clears up and your pain goes away eventually. And you feel good. All right, we got 4 more. Then maybe it's a little bit of wine or beer time. Take that sip, loosen up the muscles. All right. Whew. So there's one option for getting your glutes going, but if your hamstrings were just cramping or your low back was a little bit uncomfortable with that, maybe these series of 3 that we're about to do might be more to speed with where you belong. So we're going to be going through clamshells, fire hydrants, and circles with the hip, and we're going to do them on both sides. And if you happen to watch the shoulder stuff, we started with a bunch of circles and moving our arms around just to get the blood flowing. And that's what these 3 things are pretty good at doing for your hips too. They're going to definitely get some blood, some circulation to the area, and definitely help you connect a little bit better with your hip before you go do, we'll say, higher level exercises like the squats, the lunges, and deadlifts. So pick a side. I'm going to start on my left side. And I have my knees bent to about 90 degrees, my hips at about 45 or so. My heels are in line with my butt. And if you got your pillow, I threw mine away, but if you got your pillow, put your head down. And a clamshell is just going to be lifting and lowering your knee. The problem that we see here is that if you look at me from the side, a lot of times when people lift their knee, they rock their hip back. And that's going to put a lot of stress on your back. You're not going to use your glute very much. So I want it to be more of like if you're against the wall, and you just lift your knee straight up. And that's it. Okay, so I'll do them here. A nice little view, backside. And we're going for 5 more. That's somewhere about 10 to 15. Good, all right. Now for the hydrant, you're still gonna be in the same setup, but instead of just your knee moving, your foot's also gonna come up. Now the issue here is the same thing, is you don't wanna roll back, but you don't want to bring your foot or your knee closer to your head. You want it to stay just in line with your thighs. And so it looks like this. So we're just coming up, and you're going to do 10 of these guys. And so you don't even need a rubber band. A lot of times people do these with a band. That's fine. You're going to want to do fewer reps if that's the case, but I'm already feeling my hips screaming at me. Maybe it's because I did a bunch of deadlifts and kettlebell swings yesterday. Maybe some of you saw me doing some single arm swings. And 1 more. All right, now you're going to keep your knee up, and you're going to imagine that there's a pencil sticking out of your kneecap. Now I want you to draw 5 circles in a counterclockwise position. And now you're going to make 5 in a clockwise position. Trying to go with control. And typically I'll have people run through those 3 things 3 times, but for the sake of time here, we're just going to do 1. Now we're going to the other side. We're doing the same 3 things: clamshells, fire hydrants, and circles. So it's 10, 10, and then 5 in each direction. So remember, don't rock your hips back. It's all in your glute. Whew. Taking your time. If you need to, put your hand on your glute so you can feel a little bit more. You're using these glutes onto the hydrants, using your glutes so much because of that, we'll say glute amnesia that I talked about a little while ago. We want to remind them what they can do. And when you fire your glutes, or when you can create better extension with your hip, the brain does this funny thing where it sends a signal to your hip flexors that says, hey, you have to relax so those guys on the backside of your body can do their job. It's called reciprocal inhibition. So it's an actual signal from your brain, from your spinal cord, that goes to the opposing muscle of the one that's working. So when I flex my bicep, my tricep gets a signal that says, hey, you got to turn off. Same thing goes on with your glutes and your hip flexors. All right. And so now we're going to go, I don't know, 5 clockwise, 5 counterclockwise, whatever directions you choose to do first. All right, and the other direction. What are we doing on time? Oh, this is going to be one of the shorter ones of the week. It's good. And 5. Okay, so the rest of the stuff is going to be done on your feet so you can get rid of your mat. You might want something to help you with the balance if you know that balance is an issue for you. We're going to be doing some stork turns, some hip airplanes, and then some single leg deadlifts to finish, and maybe a flexor stretch at the end if you want it. Maybe I'll do that while looking at the camera, see what you guys have had to say. So, with the stork turn, if you got something to hold on to, grab it. If not, you're going to put one foot behind your knee. Okay? We're going to be doing this on both sides. And now your leg that's off the ground is actually the driver here. That's going to kind of tell you which way you're going. I want you to put your hands on your hips, and you're going to open up here. And as you turn to the right, you're going to actually be producing external rotation in your hip. And then when you turn towards that hip, you're creating internal rotation. The golfers out there probably know what I'm talking about with their backswing and their follow through on their lead hip. And you're going for 5 of these total in each direction. You should feel your glute fire when you open up and you go into external rotation, and then kind of relax when you come into internal rotation. Like I said, you can be holding on to something, a chair, broomsticks, sleeping friend, I don't know. All right, we got 5, now we're going to switch sides. Okay, so we're opening up, feeling my right glute work. And this might be where your limitations say you have to stop, and the next 2 things might be a little bit too high. If you can't get good range of motion here, if you feel kind of stuck and your hips moving. 4. Whoa. Now the other day I said I broke my right ankle, but it was actually my left. But my right balance seems to be worse than my left today. Okay, so that was 5 on each side. So we're trying to use that internal and external rotation again. So we went through all that stretching at the beginning to try to get the muscles to relax, maybe gain some more range of motion. Now we're just using it. But we're also working on balance there, some trunk stability stuff. But also without letting your hip drop, you're working on that glute, okay? So I'm a big fan of glute work. Anybody who knows me or knows my style of PT or training knows that how important I think they are. So those are the stork turn. That might be something you want to try another setup, but that was a big struggle. Because a hip airplane isn't going to get any easier than that, okay? So a hip airplane is working on hip internal, external rotation, but with this position. So you have a bent knee, good, here you are. I'm going to put my hands on my hip so I can tell if I'm internally rotating or externally rotating. And so you're closing your hip down and you're opening your hip up. Now, if you want to do this, but the stork turns were tough, just go ahead and put that back toe down, but that's a kickstand. It's like you want 5 to 10% of your overall body weight to be on that back foot. You don't want very much. You want to really load that working leg, closing and opening. And you're going like 5 on each side. I think I'm somewhere about 4 or 5, who knows. But you see that balance coming to kick in. 5, I'm using that glute that I've warmed up, but I'm going into internal rotation. I feel that stretch. I feel that stretch on my hip. and then I open up and use that glute. And we're going on to the other side. See, this seems to be a good view. So opening, but then I'm closing down and keeping that back leg as straight as I can. That's gonna protect my back. It's gonna make sure that those muscles in my back don't have to do too much. I got this big, most powerful muscle in my body right on the back side. That glute can do a lot of work. If you wake it up and you train it, it will be your workhorse. I think I got 2 more on each side. Kind of turning my body in a weird way so I can see the camera. Woo. And 5. Okay, so balance work, hip internal, external rotation, a little bit of abduction and adduction, things that we stretched earlier. And last but not least for today is a single leg deadlift. So this is going to progress the airplane a little bit more to incorporate some more of that hip extension that we want to encourage to open up the hip flexors on the front side of your body. So it's really easy. It's okay to hold on to something for this. It's okay to grab a kettlebell or a dumbbell. You don't need any if you do enough reps. But it looks like this. You start in this, tall, erect position. As you scoot your back leg back, it stays straight. Okay? We're working on that hip extension. Your front leg or your work leg is going to actually bend a little bit, and I want that. And the goal here is not to touch the floor. Okay? You do not need to touch the floor. I want you to go to a depth at which allows you to maintain a neutral spine and a straight back leg. If you start getting into this position, we're just doing a lot of work with our back. I don't want to stress that. If this is where you can get with a straight leg and a straight back, that's it. If you can get lower, be my guest. Get as much range of motion and use it as you can, okay? So we have an opposite hand and leg are down, and then we're back up. And you can put your foot down in between each rep, that's cool. Now I'm gonna do 8, so we'll call that 1. 2, and I'm pushing through this work leg. I'm getting that full extension in my hip at the top, and I'm locking my knee out. Woo. 6, 2 more. A little cheat I like giving people is drag your back foot until it comes off the ground. That's going to keep you with a straight back leg. And 1 more. Switching sides. Two more. And we just have one last stretch. All right, so it was a nice little series, about 30 minutes for our hips. I'm grabbing my mat here. And let's see, I can do a nice hip flexor stretch, get myself in front of the camera. Now I'm doing a nice little hip flexor stretch. Hey guys, Heather, Benny, what's up? Hey Jen. So we just ran through a little hip series to, help keep your hips healthy, happy, so you can work on your strength. I think the hips are a crucial thing for anybody who's trying to stay athletic and healthy. I think that we're going to want to work on our hips here. Hips are cracking. That's okay. My right hip cracks all the time. Oh, what do we got here? Oh, waving at people. If any of y'all have any questions, please feel free to reach out. I'll go through all the comments and everything after too, if I don't get to you. I'm trying to wave. Here we are. All right, and I'm stretching. I got about 20 seconds left on this hip flexor stretch. All right, I know Carrie, I don't know what you're referring to, hurts. Hey Kate, good to see you. Gretchen, hey. Oh, the whole fam is here. All right. what do we got? Calf. I'm wondering if there's any stretch I could do for a clicky hip. Well, it depends on what's clicking in there. We do have a labrum, which is just like cartilage joint extender. You know, if you think about your hip joint, it's like a bowl. To make that bowl even bigger, our body lays down some cartilage, and that can oftentimes get little tears. They're very common. You see them on most MRIs that most people have. Not saying that's what's going on, but you can also have your hip flexor if it's right on the side of your body. If it's on the side, that could be your glute medius tendon going over this big bone on the outside. It's called your greater trochanter. Those things could be clicking too. A lot of stretching usually helps. Oh, what's up, Sean? Let's see. Yeah. Oh man, whole crew is here. All right, guys. So I'm just stretching out my hip flexor. I got a couple more seconds here on that. Let's see. Yeah, everybody's hips are tight because we're stretching or sitting all day now. As my brother recommended, salsa dancing is always great. Brooms are great for balancing. Just put the handle down on the ground. Nunez, good to see you, brother. All right. Hip flexor stretch that I'm doing, just so you see, Amber. Let's see here. Got the mat. Knees down here. Just squeezing my glute, pushing my hip forward, not overextending the back. Just hanging out here. And I was there for just 1 minute. Oh, good. I'm glad, Jenny. I'm glad you liked it. Let's see here. Piriformis is a real pain in the butt, literally. We all suffer from that every once in a while. All right, guys. So I am going to be signing off here in a second, but this will go to my Instagram TV. It's going to go up on YouTube. I'm going to try to do one of these every week for the hip, for the back, for the shoulder. I know that there's been some requests for the neck. I'm going to try to incorporate that stuff into the shoulder for next week. They're so closely tied in together, just kind of like the back and the hip, the shoulder and the neck. Those two go together too. So we're going to be doing a lot of that stuff. I think that this has been a great week. I encourage you guys to just review, pick and choose what you found you liked. The thing that you do the most is always the most important, the thing that you're going to do. A lot of these are in the 30 and 40 minute range. That can be a little bit much sometimes. Sometimes we don't have that time. But throughout your day, just pick and choose whatever you think feels the best for you. If it's uncomfortable, it's probably not that great for you at the time. Sometimes it can be the case. It can be, something that you need to talk to a healthcare professional. I know myself, I'm doing telehealth sessions where we can eme consult and dive into some of your issues a little bit deeper. You can find me in my DMs or at kineticpotentialpt@gmail.com, or I have like 40 other email addresses you can find me. Psoas stretches is literally going to be that hip flexor stretch that I keep harping upon. It's just one of your hip flexors. It gets a lot of attention, but it definitely is. I don't want to say it's easy to stretch, but there's a lot of stretches out there, and as long as you're squeezing your glute, you should feel a good stretch. So pick and choose what you like to do, what feels good, what you're going to do. Every 20 to 30 minutes, if you can, break up your sitting or being sedentary. Even a standing desk is still not moving around. It's still not the best. It's not, those active walking meetings that people should be having. Getting up, stretching out after we've been sitting or standing is crucial. So pick and choose whatever you like. Get the blood work pumping every hour, just a little bit with some stretching and some easy mobility work. Open up those hips, open up your posture, get your spine moving. We have all these joints and muscles so we can move. So use them. Our sedentary lives have changed all that. They make us stiff, they make us uncomfortable. So, just get out there and move. I know these times are a little bit strange with everybody being home, but walk around your yard, walk up and down the hallway. Make things, as interesting as you can for yourself. Do things that you're going to want to do and you're going to do again. Because consistency is the king here. The more consistent you are with your stretching, your mobility, and your strengthening, the more healthy you're going to be overall, okay? And we all have realized that being healthy can mean that maybe certain things aren't going to affect us as much if they do come down the pipeline here. And I think we're in a time where we're seeing that. So don't hesitate to reach out. I'm on my phone a lot. I'm down to, I'm working about, 2/3 of the amount I was before all this stuff was going on, so I have a little bit more free time. So please reach out. Once again, kineticpotentialpt@gmail.com. So thanks for joining, and I'll see you all next week. Have a wonderful weekend. Enjoy your Zooms and your FaceTimes and everything with your friends and family. All right, guys.